Hello everyone. We are presenting Food Forward, an LLM based RAG model for preventing diabetic foot ulcer diseases. So we are at group number 35. Before we go on to the solution, we'll just have a look at the background.
Coming to situation and background, diabetic foot disease is a serious complication of diabetes mellitus, especially type 2 diabetics, which can lead to ulcer infections, which will become severe for the patients. So many patients they are unaware of the early warning signs, which include like minor numbness, heat changes, or early skin cracks, which couldn't be detected by them early, and which may lead to like diabetic foot ulcers. Individuals with diabetic they face around like 15 to 25% they face diabetic foot ulcers developing in their feet because of diabetes. And also from the International Diabetes Federation, it is estimated that 9.5 to 26.1 million diabetic individuals they face this DFU issues. The current challenges involves like expensive and inaccessible raw resources settings which might be difficult for the users to access, complex procedures which are not suited for primary care readings, and also it is detected like complications which can be only seen after some significant damage.
So since you explained the background, I'll come to the product. So the LLM based RAG model that we are talking about, the structure has been given here. It's an extension of the existing RAG architecture that we see. We have the tech stack that we have mentioned. Of course, we would be going through all the possible tech stacks and then selecting a particular tech to be used. The advantage would be that this LLM would be based on the specified documents, which will be further based on diabetic foot disease itself. Hence, the LLM will have more knowledge about diabetic foot disease, and also, as we know, any RAG architecture helps to reduce or increase the accuracy by around 60%. So, when it will converse with the patient, it will ensure that it will accurately tell about DFDs itself. Additionally, when the user is prompting, of course, the LLM will make the user in prompt in such a way that it will get as many as parameters or as many as inputs from the user as possible. So technically, it would be a free thing for a user to have a private conversation with the LLM.
We see that idea has both clinical as well as economic impacts. Clinically, we see that it helps in early risk prediction and in prevention of diabetes foot disease itself, because with the historical data that is being fed, it can detect if the person if the diabetes will progress or if there is any significant problem that will be there during this particular stage. Or it also helps in continuous monitoring, because continuous alerts can be given to doctors and patients, and it can help doctors in clinical decision making, and also provide psychosocial support, because people usually see this as stigma, and a chatbot can help solve this problem. When we make this chatbot multilingual, it also caters to people from different rural areas, so it is something that can be accessible to all kinds of regions. Coming to the economic impacts, we see that this model can also help reduce costs, and it helps in prevention of complications, because we cater to early risk prediction. Further, we see that policy impact can also be impacted, because it provides data driven insights, and this can shape insurance and public health policies as well. And this finally reduces the healthcare burden, because it empowers frontline workers, because there is less time that is being allocated to this, because chatbot is taking care of something that doctors take more time to diagnose, which they take more time in appointments, and also helps in analyzing trends in rural areas and coming up with solutions scattered rural areas.
So thus we are building a very high impact product, and for that we cite three main stakeholders, which would be the patients, of course, which would use or converse with the LLM. Same way, even we cite health institutes as the stakeholders, because our aim is not to replace any kind of doctor, but rather help those doctors to get a better diagnosis for the patient. And the third thing that I'll say is the one of the most important factors, because the R&D team would be responsible keeping the LLM updated. And same way, uh, from the existing research, not just related to the disease, but even the technical aspects like changing the LLM or changing the LLM architecture, R&D team would be an important thing. An extension to this thing would be the policy makers, because when it comes to LLMs, especially in the healthcare, having a proper legal guidelines to help both the patients as well as the doctors is necessary. So hence, based on the country's policy issues or even changing global politics, policy makers are necessary for this model to be deployed at every scale. So we think of doing this in 5 phases, which starting the first phase would be the actual data collection, which is the most important phase. After that, we'll go on to building LLM, again test it through various research papers that we have cited. Even we have provided the various methods and the references that we are doing through the zip file that we are uploading on the portal. So with this, finally, once the chatbot as an crude architecture is ready, we can integrate it with some good UI UX that can be easily used by the user. So we hope you liked our idea, and if you have any additional questions, please let us know. So with this, we aim to cure over the diabetic foot disease in most simplest and most economic way as possible. Thank you.